This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning and welcome into the program. It's Mon Health Talk. I'm your host, Dave Wilson. It is February, and February is, of course, Heart Month. So we have heart-themed shows lined up for you all month long. We begin this morning with Dr. Krishna Bingi, cardiology with Mon Health. Doc, good morning.
Hey, good morning. How are you guys doing?
I'm doing well. Did I get the name close, or did I get it pretty close?
No, it's really, really good. So last name is Bingi, B-I-N-G-I, like a bingo.
Okay.
Hit
the G there, Bingi. Oh, well,
Yep.
I appreciate you taking some time. We're going to talk about, obviously, the heart and specifically blood clot solutions this morning. But before we get into the subject at hand, you can talk about you for just a moment. We'd like to know a little bit about your background, where you come from, how you where you got your education, how you ended up with Mon Health.
Absolutely. So I was born and grew up in India, and I completed my med school in India. Then I came here in 2007 to pursue my master's in public health. And then I came to WVU to finish my residency and fellowship, and fellowship in cardiology. Then I did an interventional fellowship after that, the 1 year subspecialty in it. So then I started working at Mon Health in 2017.
What drew you to cardiology and working with the heart?
Oh, yeah. So I was drawn into the medicine because there was nobody in my family in the medical field. So I said, okay, so I wanted to do something different, and I was really fascinated by the field of medicine. Then I wanted to combine the medicine with my father's aspect. He was a lecturer in physics, so the heart is like, I was really intrigued by the hemodynamics and stuff, and the anatomy of the heart with the fluid dynamics. So I was really drawn into cardiology. Yeah.
So I've got to ask, how does a guy who grows up, goes to medical school in India, end up in West Virginia? We're always amazed when that scenario plays out.
Absolutely. So yeah. So I was interviewed here for internal medicine and pediatrics. So I came to Morgantown in 2008 for the interview. I loved what I saw here because I grew up in a small town in India. Whenever I came here, it just resembled my hometown. I said, okay. And the people were really nice. The interview process really well. Then I came in 2009 and never left.
That's what West Virginia does to you. Once you get here, you never leave. And that's a good thing. That's a good thing. All right. Sources have told me, and my sources are pretty good here, that you have a nickname, the Clot King. You've got to explain. What's that all about?
Oh, yeah. So a couple of years back, we started this new program for pulmonary thrombectomy. So the people that comes with blood clots in the lungs, so it is a very devastating condition. So when this new procedure came in, we are first one to implement it, and we had a very good success. And what we typically do is we go and take the blood clots out of the lungs. And these are the clots. So when we take these out, because we are doing this procedure more often, then they said, okay, they want to do something. So the cath lab teams are really funny. They wanted to make something. So they said, okay, you are the Clot King because you're taking the blood clots out of the lungs. That's how the name came up.
So what is a blood clot? It sounds self-explanatory, but what is it? How is it formed, and what kind of a risk does it pose?
Absolutely. So the blood clots usually, so when you have an injury, so the blood clot forms. That is the normal response to prevent from bleeding out. So, but if you have, there is external injuries. Sometimes in the blood vessels, if there is some processes that happens and there is derangement in your blood clotting mechanism, so it forms more clots. So if you if you have a surgery, if you are sedentary, if you have infection, so they are more prone to develop blood clots. The blood clots usually starts in the legs most of the time. So sometimes they break loose and go to the lungs. So that's where people got into trouble. So if it is in the leg, they usually have leg pain and swelling, redness, all these symptoms. But if it breaks loose and goes to the lungs, that's where the problem comes in. So it stops the blood flow to the lungs. Sometimes people just pass out immediately because there is no blood flow. Sometimes, most of the time, they get like chest pain, shortness of breath. They have difficulty breathing, huffing and puffing. The less common scenarios and very sick patients just pass out. So that's what the blood clots does.
When does it become? When it gets to the lung, is that when it becomes an issue for the heart, or can the clot move to the heart? Okay.
No, it does not, because sometimes it can. So there is sometimes like one-third of the people have a communication between the top two chambers of the heart. So that's everybody's like most of the people born with it, and two-thirds of the people it just closes off, and some people it stays open. If the blood clot goes from the right side of the heart to the left side of the heart, and it goes to the brain and causes a stroke. So that is one effect. The other effect is if you have the blood clot in the lungs, it reduces the blood flow to the left side of the heart, where it pumps the blood to the whole body. So you're not getting enough blood flow. So then they pass out and they have bad heart rhythms, and these things happen. So that's large blood clot in the lungs is the main concerning thing, and it puts a lot of pressure on the heart. So bad things do happen.
So are there people who are at more risk for blood clots, and is this a preventable condition?
Yeah, so especially there are certain conditions that are a high risk to develop blood clots. If you have a hip surgery, knee surgery, because you're not moving as you should be, so that increases the risk, because any kind of stress on the heart or on the body, they are more, we call thrombogenic. That means they are more prone to develop blood clots. The other thing is if you are acutely ill with something and you are not moving as you should be, it increases the risk. The third thing is we always tell people if they are going on a long plane ride or if they are going on a long trip, we ask them to just get out every couple of hours, walk a little bit, just don't drive continuously, because sitting sedentarily for a while increases the risk. So some people that, especially young women that take the birth control pill, they are at slightly higher risk to develop blood clots. And recently, the COVID-19 infection, it also increased the amount of blood clots that we see. So these are the things. And how do we prevent it? Because this is what typically the surgeons do. If they have a knee or a hip replacement, they put them on blood thinners for a time being to prevent that. And if you are really sick, so people, if they are in the hospital, we put them on blood thinners. We ask them to just mobilize as soon as possible to prevent this form. And as I said, if you are on a long plane ride or a car travel, just get out of your seat and just walk frequently. So it prevents from happening.
We are talking to Dr. Krishna Bingi this morning, cardiology with Mon Health. We're talking about blood clot solutions. We'll continue the conversation right after we take a quick break. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning is Dr. Krishna Bingi, cardiology at Mon Health. Been talking about blood clot solutions. And doctor, can you talk about the Inari FlowTriever device and what is this and what does it do?
Yeah, so this is really a big difference in how we treat the blood clots, especially in the blood clots in the lungs and blood clots in the leg vessels. So it came into the market, I would say, 3 to 4 years back. So what it does is, traditionally what we have done with the blood clots in the lungs was we were actually giving them blood clot busting medications to bust up the clot so they improve the blood flow. So we used it only for people that are like really sick. Their blood pressure was low, their oxygen saturations were low. But the problem with that management is you are giving the clot busting medications. They were actually increases a significant increase in amount of bleeding. So the people start bleeding everywhere. Especially the major risk we have been dealing with was bleeding in the brain. So that was a big concern thing. And there are a lot of restrictions on when you can use the medication. So then this came in, that NRE flow retriever. So what it is a big catheter. It's a tube. We go through the big vein in the groin, and it goes to the right side of the heart, and we go to the artery that supplies to the both lungs. And we take a picture and see where the blood clot is, and we take the catheter, the tube, closer to the blood clot, and we suck the blood clot out. So we can actually go into the branches of the arteries and try to suck the blood clot out. We do the both lungs based on where the blood clot was. So, and for this, you do not need to give any clot busting medication. We just need to give the blood thinners during the procedure and continue the blood thinners. So the good thing with this, you see the improvement right away. So we are done with the procedure. Most of the time people come off of the oxygen, their blood pressure come up, and the next day they can move on. They feel like it never happened anything. So that is the big game changer in how we treat the blood clots in the lungs.
You kind of already hit on my next answer about the or my next question about the procedure being how invasive is this, and what's the advantage? But it sounds like this is for the patient within a day or two. You're kind of back to normal.
Yeah, kind of back to normal, because as I said, when before you were actually giving, if you're not a candidate for the clot busting medication, we put them on blood thinners. The blood thinners prevent from future blood clots happening. They don't do anything with the existing blood clot. Your body actually absorbs the blood clot over the course of next several months. So you are still dealing with the blood clots for the next several months. So you are not back to watch yourself for the next 3 to 4 months, maybe 5, 6 months, maybe never. Okay. So with this, if we can treat in time, they're back to normal next day, and most people will go home next day.
Can anyone get blood clots, or are there certain groups or ages that you see more commonly?
So, unfortunately, anyone can. But as I said, there are some risk factors. Sometimes it actually runs in the family. They have some bleeding or clotting problems that runs in the family, so they are more prone to develop they have some gene defects, or so they're more prone to develop blood clots. And as we talked about COVID-19 infection, if you are requiring oxygen, we know for sure it increases the risk of blood clots. It does not mean you can be young, you can be old. It does not. If you have a COVID-19 infection, it can increase the blood clot. And as we talked about, long plane ride, birth control pills, these are and any kind of surgeries, if you are sedentary for a while after that, they are all increased at risk.
Do the three main rule, I call it the three main rules when it comes to heart health: diet, exercise, and either quit smoking or not start smoking altogether. Do those apply when it comes to blood clots as well as good practices? Absolutely. Because as we said, so doing exercise. So if you are really active and do exercises, it prevents from blood clots happening in your legs. And smoking, we know, definitely increases the thrombogenicity. That means increased blood clots. So absolutely, diet involves in everything, because if you are not eating right, not eating the right way, that also changes the metabolism in your body, and it also changes how you clot and how you bleed. So these are the things, absolutely. So these are the main three pillars of cardiovascular health. And overall cardiovascular health, like you said, those are the three main pillars. Any other advice for maintaining healthy heart and hopefully, I always kind of throw this in tongue-in-cheek, avoiding coming to see you? Oh, yeah, absolutely. We always talk about this motto. So this is prevention is better than cure. So you will never seek cure. You always look for prevention. So I would tell the patient, so I wish I can see you outside the office or outside the hospital rather than seeing you in the hospital. In the office is okay, because we are talking about office is predominantly we talk about prevention. So that is a good thing. The hospital, we try to avoid seeing in the hospital. So diet, exercise, stop smoking, and changing, especially
So now we have so many modes of how you can track your exercise. So those are the things that you can use. And if you have any questions, just please talk to your primary care provider, and they have lots and lots of information on what you can do, what you can't do to prevent cardiovascular problems. Especially, it is more prevalent, unfortunately, in West Virginia in our communities. So that's what we should do.
Only got about a minute here, but have we gotten better? And this is probably anecdotal evidence. Since we have the smartphones and the watches that can keep track of how far we're walking and can keep track of heart rate and all this, is that helping with diet and exercise, or are we using those tools at our disposal? Have you seen?
Yes, some of them are using these tools, especially to find the heart rhythm problems and tracking those. But we are still way behind. We still have to move on with the advancements in the tracking devices and how we can educate the patients on how to accurately use them, because there are a lot of data outside. So there's sometimes it can be misleading. So finding the right tools and talking to the right people to guide you in the right direction is the most important thing, because you can be easily sidetracked and get some false impressions and stuff.
Yeah, sometimes as far as the exercise go, maybe just looking down and going, I only took how many steps today? Maybe that's enough of a wake-up call to go, maybe I should do a little more exercise. Maybe I'm not doing as much as I thought I was.
Yeah, that's true. That's true.
Of course, you can always get more information going over to the website monhealth.com/heart for more information. And as I said earlier, it's February, so we'll be talking about the heart all month long. Our guest this morning, Dr. Krishna Bingi, cardiology at Mon Health. Doc, appreciate the time this morning, and hope to talk to you again very soon.
Oh, thank you very much. Thanks for having me.
Absolutely.
Have a good day.
You as well. And again, more information available over at the website. You can go to monhealth.com/heart. And February is Heart Month, so we'll be talking about the heart all month long here on Mon Health Talk.